close the door to ensure privacy. Wash my hands first. Hello, my name is Cailey Pounds and I will be your student nurse today. The doctor just ordered for a Foley kit insertion. So before I start, I just want to verify your name and date of birth with the order. Okay, can you say it for me? All right. Okay. So now that you're all verified, do you have any allergies, especially to iodine, betadine, or latex? No? Okay. And have you ever had a Foley catheter before? Okay, so it's just going to be a tube that's going to go in your urethra to your bladder, and it's going to help remove some of the urine. So first I'm going to raise the bed to a comfortable working height, waist level. Okay. Perform hand hygiene. And then put some gloves on. Okay, now I'm going to position the patient in the dorsal recumbent position. And if it were a male, I would leave him supine. All right, Miss Bailey, I'm going to be exposing you a little bit so I can perform some perineal care. I'm going to get a cleansing wipe, outside, inner side, and then down the middle and down strokes. Discard that and throw my gloves away. Now I'm going to hand hygiene again, and I'm going to set the kit up. Okay, I'm going to be using this bag to dispose of things quickly. All right, and to open, you start away from you, then the sides, and then towards you. Okay, first I'm going to apply my sterile gloves. All right. Now that my sterile gloves are on, I'm in a sterile field, and if I break it, I will verbalize so and start over. Okay, so to prepare everything, I'm gonna go ahead and get my betadine swabs ready. And then I'm gonna lay down my mat, shiny side up. And for a male, you would use another pad, but for female, it's not really needed, so we're not gonna use it. Okay, so I'm going to get my lube ready. Squirt some in there. Remove the protective sheath off of my catheter. And get it nice and lubed up 2 to 3 inches. All right, and also I'm gonna secure my syringe to the port. Okay. So first I'm going to apply the betadine wipes. And I'm going to use my non-dominant hand to spread the labia, and this hand is now contaminated. And dispose of them. And then down the middle. Okay. Now I'm ready to insert my catheter. It's already lubed up for me. All right, Miss Bailey, I'm about to insert the catheter. Just take a few deep breaths. All right, 2 to 3 inches, and then I start to see urine, so I'm going to do another 2 inches. Okay, and now I'm ready to inflate the balloon. Okay, and I would dispose this, but I'm just gonna set it to the side because I'll need it later. All right, and just pull on it to make sure it's in there. And then I'm gonna grab a piece of tape right here. And secure it to her leg. And if it was a male, I would be securing it to his abdomen. And I'm gonna take the urinary bag and put it underneath the bladder onto the bed frame, not the rails. And this is so that gravity can help drain out the urine. Okay, so now I'm just gonna clean up my area. Okay, and the doctor also ordered a urine specimen, so I'm gonna go ahead and re-sanitize my hands and apply some more gloves. But before I collect the urine specimen, I am going to clean the perineal area once again, just to get all that betadine off. Clean off that betadine, and then I'll throw this away, and I would discard my gloves and put some more on so I could collect the urine specimen. And to collect that, you're going to use this port right here, and you're going to take an alcohol wipe first to make sure it's clean, and you're going to take this 10mm syringe and just extract some of the urine. And then you would take this cup, which I would have already prepared, like so, and then just squirt it in there. And then on the bottle you will include the patient's name, their date of birth, my signature, and today's date and time, and also the room number. Okay, so now we will send that off to lab. And then another way you could take a urine specimen is from this port from the urine bag. Okay, so Foley catheter is inserted. We're just gonna put the patient in a more comfortable position. All right, are you comfortable, Miss Bailey? Okay, great. And now I'm gonna lower the bed for patient safety. And I'm also going to make sure that the side rails are up and that Miss Bailey's call bell is in reach. Okay. And, okay, it's a new day, so I'm going to wash my hands, come into the patient's room. Hello, Miss Bailey. It's me again, Cailey Pounds, and I'm here to remove your Foley catheter. The doctor just ordered this removal. But before we get started, I'm just going to verify your name and date of birth. Can you verbalize it for me? Okay, and it matches. So before we get started, I'm going to raise the bed to a comfortable working height. Okay, and I'm going to go ahead and position her into dorsal recumbent. Apply some hand sanitizer and gloves. Okay, now I'm going to expose you Okay, so to take out the catheter, first we're going to need to drain the balloon, and it will just fill itself up. Okay, now the catheter is ready to be taken out. All right, Miss Bailey, I'm gonna remove this. It might be a little uncomfortable. Just take a few deep breaths. Okay. And also, before I even took it out, I would have drained the bag into the toilet first. So now that it's all out and the bag's drained, I would just throw it in the trash, and I will change my gloves. Hand sanitize so I can clean Miss Bailey off again. All right, Miss Bailey, I'm going to clean off your perineal area, the cleansing wipe. Okay. Now I'm going to place the patient in a comfortable position and make sure that they have their privacy, and I would document the removal, and I also would have documented the insertion as well. All right, and now before I leave, I'm just going to lower the bed. And I'm going to make sure the side rails are up, and I'm going to go document.